Thanks, Corey. Maybe Erin, turning to you now. You've spoken in the past that response to catastrophes, the problem may be less one about mobilizing money and more about collecting and following through on the pledges that are made. Why is there such a discrepancy between commitments and disbursements?
Thanks, Trish. And just briefly, I do want to say a thank you to the IOM for including me on behalf of the One campaign. I'm very conscious that I think we're the only civil society group here in the room. And I think with all the conversation about financing, it inevitably turns to political will pretty quickly. So I think the civil society voice is really important as we learn these lessons moving forward. I would just say as a slight caveat to your question, I do think mobilizing new money was extremely important for Ebola, particularly in the early months, as so many others have already said, when things were moving so slowly. But I do think once leaders did start to step up to the plate, with the dam really sort of breaking open around September with Obama's speech at the UN in particular, then we sort of walked into a new kind of challenge. And from our perspective, the challenge is this. We strongly believe that the tools we have today for tracking resources in a modern global health crisis like Ebola are simply not fit for purpose. We found that in many instances, it's of course, possible to find a bit of information about one donor's contribution or pledge. There's still no one-stop shop for donors, implementers, and the public to reliably understand, measure, and compare the amounts and types of resources that have been pledged, what resources have actually then been dispersed, and what gaps remain unfilled. And in particular, our research identified two major sub-challenges within that: limitations of existing tracking mechanisms and inconsistent reporting by donors themselves. So I'll start first with the tracking mechanisms that do exist. When Ebola really flared up, particularly starting in the summer of last year, we saw at least 4 different tracking mechanisms become operationalized. Perhaps the most formal and well-recognized was the UN's OCHA FTS tracking system, which largely measures purely humanitarian flows. The World Bank set up its own mechanism to track pledges. The UN Special Envoy for Ebola hired consultants to produce reports on resources that were flowing. And one itself, in the absence of better information, set up our own interactive tracker led by my colleague Aria to track both quantitative and qualitative indicators around resource flows. A few limitations of all of those, ones included. They're all understaffed. I think we were surprised that many of these bodies weren't staffed by tens, if not hundreds of people really actively gathering information. In some cases, it was a few people at most. They're largely entirely reliant on donor self-reporting. So even though they put out the best information that they have possible, they frequently perpetuate reporting inconsistencies, even while giving the appearance of a standardized data set. There's wide variance in the mandates that those trackers have for what to track and what to report, which can lead to further confusion. For instance, FTS, again, only really designated to track humanitarian flows, but in a crisis like Ebola, where donors are simultaneously pledging humanitarian resources, in-kind contributions, health workforce contributions, long-term recovery functions, R&D investments, it gets really messy really fast. And the flip side of the coin that none of us really fully accounted for was that none of those tracking mechanisms were built to follow the money pledged or even dispersed through to the project's implementation on the ground. And even if such a system existed, it's not clear whether all donors would report in sufficient detail to allow for that type of nuanced analysis. So that's the limitations on the tracking mechanism side. I would argue that a second challenge really comes from donor reporting themselves. I'm fully conscious that I'm sitting on a panel with 2 donors, and there's many more in the room, so I'm not going to name names here today, but just to say there is certainly a wide continuum of donor behavior in crises with respect to how they're reporting on their own flows. There are those that are very transparent and very willing to work with groups like us to better understand what they had committed and where those resources sat at any point in time. There are those who put out very muddled and different information at different points in time, but perhaps not maliciously so, more often a victim of the right hand not knowing what the left hand was doing within governments. And then another group, smaller but still there, that we would argue were almost willfully misleading with what information they were sharing, or certainly were not willing to build the systems that would allow for more transparent reporting. Within donors, we saw a discrepancy between those willing to report on actual disbursements versus those who are only willing to report on what resources they had committed but not yet dispersed, which again didn't allow for a full apples to apples comparison. And we also saw great confusion and a lack of clarity around how to count in-kind contributions. So many countries would monetize the in-kind contributions they were making, which were incredibly important in this response, but again, sort of further muddled the response. Add into the mix the real difficulty that we want to acknowledge of on-the-ground implementation, absorptive capacity issues that others have spoken to over the last day and a half. I was sort of chuckling to myself at the Unitaid lead's quote about, you can throw money out of a plane and call it dispersed, but that's not really what we want. So we sort of fully acknowledge that's an additional challenge. So all of this pulled together leads to an incredibly murky picture for accountability, which from our perspective allows an environment to flourish in which pledges and commitments are not always dispersed, to get back to the original question. And there isn't sufficient accountability yet in the system to actually hold leaders' feet to the fire. So we end up in a situation where we are today, where certainly a lot of resources have been pledged, and certainly a good chunk of those have been dispersed, but we don't really know to what extent all or most of them have really reached the ground and their intended recipients.
Thanks, Erin. Maybe as a follow-up, as we're moving or have moved into the recovery phase, more or less, it feels even more important for donors to understand where the gaps are and therefore be able to point their funding appropriately. Can you describe how you would see better tracking of aid flows to help donors and recipients both understand the gaps better and where best to contribute?
Sure. So from our perspective, this isn't just a dry accounting exercise. And it's not something we should just assume will always be there in development crisis. I think this is a real area for action moving forward. And it's a matter of effectiveness, efficiency, and ultimately saving more lives in the next crisis. So let's start with the fundamentals. I would argue today, more than a year and a half into the crisis, there's no one who can honestly and accurately answer the question, how much money has been pledged for Ebola and how much has been spent? We can guess, we can estimate, we can model, but our inability to really answer that question in a specific way inhibits everything we do, particularly as we move into recovery. We saw this have real-time implications for implementation on the ground. Throughout the crisis, for example, it was really difficult to pinpoint and then advocate for specific needs and gaps to be filled. Just as one example, we often heard throughout the crisis, particularly in the fall, the need for more healthcare workforce. But when you tried to actually ask, how many workers do you need, and where, and with what capacity, it was really difficult to get an answer. And so therefore, for an advocacy group like One, we're happy to put out a call, but we don't have any of the specifics we need to really mobilize any of the help that comes through. You saw countries say we're going to put forward 800 healthcare workers, but we have no idea, A, if those healthcare workers ever materialized, B, what capacities they had. Were they just local citizens looking to volunteer? Were they trained surveillance and epidemiology experts? We just really didn't know. And it was shifting week to week, month to month, so any call to action may have been outdated a month later. It also impeded organizations' ability to plan and coordinate with each other on the ground. We've heard a lot about the importance of coordination yesterday and today, and I think that problem still lingers with both gaps and duplication of efforts and no real shared specific understanding of what's needed in a real-time capacity. We also now see that the three most affected countries have pulled together what they've called the Mono River Union Marshall Plan for Recovery, which we think is a really important next step of the countries saying for themselves, this is what we think we need to really rebuild from this crisis. But even there, again, we get back to challenges of what's apples to apples, what's already funded, what's left remaining in the pipeline from emergency funds that could be repurposed to recovery funds. What were bilateral donors already planning to spend in these three countries versus what might be a new commitment and pledge worth tracking? We're in this really murky middle ground between a true emergency response and a recovery response, and that's further complicating the picture. And as I alluded to before, all of this really impedes a wider effort around accountability. So I think that's not just for groups like One who are trying to really hold donors' feet to the fire, but it's also for local groups on the ground. We've met with activists from Liberia, from Sierra Leone, from Guinea, who really want to do the right thing, who know their countries have a reputation for money being mismanaged or being misused, and really want to write that story in a different way and hold everyone accountable for delivering services. But they don't feel like they have the information they need to do any of that real accountability work on the ground. We also see a real phenomenon emerging of donors, or at least some donors, robbing Peter to pay Paul. So without sufficient transparency around the pledges that they're making, we don't always know, or sometimes we actually do know, when they're taking money that would have otherwise gone for malaria or for HIV or child vaccines and is simply being repurposed for Ebola. So they're getting all the praise for stepping up to the plate, and yet, really impeding the wider global health effort that is so important for recovery. And we also have received, frustrated calls from journalists. It's rare when a journalist wants to write about development. We should always be thankful when they do. It's often sort of called the broccoli of news. And in the case of Ebola, although I like broccoli, I guess, which is fitting. So in the case of Ebola, we had journalists who wanted to write these stories and write many stories. And yet they too tried to report on how much funding had come in. And they were so frustrated. We literally saw many journalists say, I give up. I can't write this story. Or perhaps even worse, they tried to write a story and conveyed misleading information based on the limited streams that were out there. So this is hugely problematic. But we think there is real opportunity to move forward and make a better system moving forward. We're encouraged that this year, in all of the hype of the Sustainable Development Goals that will sort of come to a head in September, there's a lot of momentum around what people are calling a data revolution. And we think with better data, you can see much greater return on investment. We can understand what interventions are having an impact. We can build the risk modeling and the insurance schemes and everything else we've already talked about today, grounded in a more assured data set. And in the case of Ebola or in future crises, we do believe we can save more lives more efficiently. So we're thrilled that the IOM has considered this part of the financing conversation and think this debate is really integral as we learn lessons moving forward.